Continuing our presentation, as we do each week, we have Brian Gottschall, our Director of the Department of Emergency Services, here to present the Berks County COVID-19 data report. Brian.
Good morning, Commissioners. Thank you very much. Our report this week is going to be fairly brief. Want to start out, as we always do, looking at our cases and testing slide, our cases being the blue line on a 14-day smooth period, and our testing being the orange columns with a 7-day smooth period. The good news that I can bring on this slide is that we appear to have peaked over. Our peak numbers appear to have run out in the 14-day period prior to October 11th, and we've been on a steady downswing since then. Although we have had a couple days of high case counts in the last 2 weeks, I believe on average we're going to see that number continue to proceed downward for the foreseeable future. So again, I think we were all hoping to see us get past this Delta surge, and the data is beginning to look like that may be the case. But as always, we want to monitor this for a number of weeks and see that trend really continues. Our positivity numbers do continue to be high. How is our case count going down while our positivity appears to be still elevated? The answer is because our test numbers are coming down proportionally with the case count. And perhaps that's good news. Perhaps that's indicative of there's a lesser amount of illness in the community that is causing people to go and get tested out of concern that they have COVID. Again, all trends that we need to watch. Talking about pediatric case counts, as we began last week, we see in that 5 to 18 range, the last week's numbers, as we can report, do show a dip from the week prior. Our 0 to 4 numbers continue to be very flat. This is all very early data, kind of new data, thanks to DOH making it available now. So we don't want to draw any significant conclusions until we have a fair amount of data under our belt that we can be looking at. But anytime we see a downward curve, that's good news. Our hospitals are pretty much the same as where they were last week. Slight variation in the numbers, but they look effectively the same with respect to impacts on hospital operations. Again, we're still remaining optimistic that we will be able to show vaccinated versus unvaccinated numbers at the tower facilities, and we're appreciative that St. Joe's is continuing to make that available, demonstrating a significant difference between the impacts of COVID on those who are vaccinated versus those who are unvaccinated. Our death slide continues to show that upward climb, not surprising, even though we're feeling a little bit good about where our case counts are going. As we've illustrated, going back all the way into last year, unfortunately, people will still be losing their lives in an upward counting fashion, even after our case numbers tip over, because the deaths are a trailing indicator of the COVID cases. The only thing I'll really mention about this slide, which has been very static for a number of weeks prior to last week we saw a significant increase in our first dose numbers, or our at least one dose numbers, in comparison to other counties in the state, and that has really kind of corrected back to 19. So we're not 100% clear on how that data got out of whack in the last week, but it makes a lot more sense that we're back where we see it today, with us in that 19th place per capita in the Commonwealth, which is where we've pretty much been all along, and our fully vaccinated per capita numbers in comparison to other counties, again, remaining fairly static with an occasional one up or one down move, but overarchingly keeping us in the same place. With respect to Pennsylvania's population goal for over 18, we've exceeded the 70% number in Pennsylvania. We're closing in on it here in Berks County. And when we look at that based on our first dosers, if we look at the raw numbers, we're well in excess of that, up around almost 80%. But the reality is that when we statistically back out those who we think it's unlikely are going to pursue full vaccination, we're really just in a position to have crossed over our 70% goal if all of those folks complete their vaccination series. We continue to lead Pennsylvania in growth on average since May 26th in all of the categories except the 12 to 18. I think that's good news for us, but perhaps Berks Countyans were late adopters, but they continue to go and get vaccinated at a rate higher than the state overall, which speaks to there being some change of mindset in Berks County, which is good news. As always, we want to provide a plug for the doyourpartberks.com website, where folks can find a lot of great information about COVID, about vaccines. And the only other thing I want to mention is kind of just a preview. We do expect that we're going to see some news in the next couple weeks about that 5 to 12 age group. There's already been some information from FDA with respect to how that vaccine's likely to work. The size of the dose, how it's going to be orderable by our vaccine providers. And we would anticipate that CDC will likely have something to say about that approval sometime in the next 2 weeks. Our schools and healthcare organizations throughout the county are already looking closely at this and working to be prepared to be able to make that vaccine available to folks who would desire it be available for their children. With that, Commissioner, I'm back to you unless there's any questions.
Thank you very much, Brian. Any questions for Brian? Very good, thank you.